Because testing rules have changed, looking at positive case numbers and case rates is a less reliable indicator of what's going on, and certainly a less reliable indicator of how much community transmission we have. But even so, we had nearly 1,500 positive cases in the week up to the 11th of April. The Office for National Statistics surveillance study is now one of our main sources of information, and there is a bit of a lag with the numbers, but what this suggests is that in the week to the 2nd of April, about 1 in 13 people in England would have tested positive. There is a bit of regional variation, but during that week, cases were still thought to be rising in the North East and in Northumberland. And in fact, in Northumberland, they were estimated to have increased from the previous week to about the same as the estimate for England, so about 1 in 13. The government has now lifted all COVID restrictions in England, but with level of infections as high as they've ever been, we're still very much in the grip of this pandemic. This isn't a mild infection, it's just less severe in people with a reasonable level of immunity. So while community transmission remains high, it's just sensible to continue to be cautious and not to drop our guard. As England learns to live with COVID, we all need to make long-term changes to our behaviour so we can reduce the risk of passing on this and other infectious respiratory illnesses. The thing is that you don't know whether the person sitting next to you or the person sitting next to them or their friends and relatives have a good level of immunity or not. So continuing to deliver on those simple behaviours which we know reduce the risk of passing infection on makes a real difference. And the more we all do them, the bigger difference it makes. There are 5 things we're asking people to do. The first one is vaccination. Take up the offer of the vaccine. It's never too late to have your first dose or complete the course if you haven't done so. The second one is ventilation. So let fresh air in if you're meeting indoors or meeting outside. Choose to wear a face covering if you're in crowded and enclosed spaces, especially if you're with people you don't usually mix with. And if you do feel unwell, try to stay at home. But I know that that's not easy for a lot of people. And then finally, just keep doing those good hygiene basics, washing your hands regularly, adopting the catch it, kill it, bin it principles, and just keeping your surroundings clean. These are measures that we've become really well accustomed to, and they'll continue to be sensible and effective in protecting you, not only from COVID, but from other infectious illnesses as well, and actually not just respiratory ones. Well, most people can no longer access free universal symptomatic or asymptomatic testing. Lateral flow tests are available to purchase from most major pharmacy chains and other outlets, and free COVID tests are still available to help protect specific groups, including eligible patients, NHS and care staff. Well, you won't know for sure if you've got COVID, but if you have those symptoms which have been characteristic of COVID infection, so a persistent cough or a loss of taste or smell, or if you've got a high temperature or you don't feel well enough to go to work or carry out your normal activities, then try to stay at home and avoid contact with others. The symptoms are very similar to symptoms of other illnesses, such as colds and flu, but actually it's better if you can avoid passing those infections on to others as well. The vaccine will always be our best defence against the virus, and I would still strongly recommend that everyone eligible should have it if you haven't already, and keep going back for any future boosters. Every person who gets vaccinated adds another layer of protection to our communities.